Sunderland.
Madam Speaker, I'm humbled to be called in this debate, and can I please commend the members for Hastings and Rye, also Darlington, for bringing this debate to the House this afternoon, and also the Minister who sat through, shown amazing resilience with what's been a long evening. What I've noticed this evening about this debate is that members that have spoken sort of fall into broadly two camps. So there are those who've had personal experience of hospices, family members who have suffered and needed the facility, and those speeches have come across amazingly, real pathos, real depth, and I commend all of the members that have spoken so personally about their journeys, and also perhaps members like me who have not had personal experience of hospices but recognise the importance of what they do. And if I may, in the time that I've got, I just want to talk about two hospices in my constituency which I think are very important. The first one is that Thames Valley Hospice, as it was first known, was officially opened by Her Majesty the Queen in November 1987 in Windsor at Hatch Lane. And that's been serving my constituents and others in Berkshire since that time, showing amazing strength of character in supporting so many people. And my contention this evening with the Minister in her place is the fact that, as we've heard, we do need to refine funding models for hospices. It's been said before numerous times this evening, but in my view the NHS does need to cop up a bit more support. And in my view also it's about timing, because Thames Hospice, I know, awaiting its funding settlement for 24-25 with barely 2 weeks to go, is still waiting for that decision from Frimley ICB. So it's about funding, it's about how much can be funded by the taxpayer, but also it's about getting funding notified up front, and that's really important because it means that they can plan ahead for the year. Thames Hospice in 2016, having provided so much care all that time, was granted planning permission to build a new 22 million state-of-the-art facility on a brand new 8-acre site by Bray Lake, which is just outside Maidenhead in the Royal Borough of Windsor and Maidenhead. And why is that important? Well, it's important because that serves Frimley ICB, it serves many constituents to the east of Berkshire, including Bracknell, and I know of many constituents that have had fantastic care there. And in January 2019, work began on the construction of that site. By 2023, with the new site being built, and I visited earlier last year, an absolutely incredible site with so many fantastic staff, a cafe, dedicated services. Thames Hospice has supported around 2,500 patients and their loved ones annually with high quality medical and emotional support. This is all about making people's lives easier and making sure that the remaining time on the earth is made as dignified as possible, and we can't underestimate that. We cannot put a price on that, we can't put a value on that, which is why we have a responsibility, in my view, to fund it properly. As for the future, by 2030, 15 million people in the UK will be over 65 years old. We also know that the number of young people with life-limiting neurological conditions has increased by 64% over the last 10 years. That's a really serious figure. And also the incidence of cancer in people under the age of 50 has risen by 79% between 1990 and 2019. Just think about that. These are really serious figures. And what does that mean? It means that the demand for hospice services is only likely to increase over time. Also, costs have increased by 9% at Thames Hospice over the course of the past year, with no commensurate increase in government funding. And that's a very similar picture that we've heard from other speakers this evening. So to put a figure on it, every day at Thames Hospice, they've got to raise £38,000 to subsidise the costs of care. And without even considering investment to grow in the future, this will increase to over £50,000 per day by 2030, based upon a 4% increase year on year. It is a similar picture elsewhere. And to put it in perspective, Thames Hospital itself needs £18.5 million for 2,500 people every year. It's really stark. And as I mentioned earlier, Thames Hospice is the end-of-life care provider for the Frimley Health Integrated Care Board in East Berkshire. So it's of direct relevance to my constituents, and I can't thank the staff and the directors at Thames Hospice enough for what they do. Just before I finish, I want to just mention Sebastian's Action Trust as well in Crowthorne. Why is that important? It's important because it provides palliative care for children aged between 0 and 18, and it also supports their families. And a key part of the support that the brilliant Sebastian Actions Trust provides is that it provides memory-making support for the families that use the facility. And it also continues to support the families once a child goes to the end-of-life care. Losing a child is devastating anyway, but the fact that Sebastian Actions Trust does it so brilliantly in terms of the support that it provides to families, even after that life event, is really remarkable.
Would my honourable friend give way?
Please do. Thank you.
I'd like to thank my honourable friend for giving way, and just on the issue of funding for children's palliative care, I'm very fortunate in my neck of the woods in West Yorkshire to have the Forget-Me-Not Children's Hospice. We also have the Kirkwood Hospice as well. But just bringing this backbench debate to an end and focusing on hospice funding, I just wanted to highlight the Together for Short Lives campaign ask. And I've just been looking again at their main campaign ask. I know he's mentioned this. It's not just sustainable funding, it's having the surety of that funding moving forward and a multi-year promise and confirmation of funding beyond 24-25 so that children's hospices can plan for the future and continue delivering and caring for children with life-limiting illnesses and for their families.
Can I please thank my honourable friend for his intervention, and it's very, very timely, because as we know, palliative care is not formally funded by the NHS, it's privately funded, and it cannot be right that such an important function is hand-to-mouth in terms of the funding that they need. And to prove that point, Sebastian's Action Trust in Crowthorne is going to close their Crowthorne site later this year, called the Woodlands. And as sales expected in autumn 24, it physically cannot afford the care that it's giving to so many families, with the result that it's having to rationalise its own estate and move elsewhere. So in conclusion, in my humble view, with the Minister in place, the funding at the moment from the NHS is just not enough, both for our hospices and also for our palliative care. Please do.
I thank my honourable friend for giving way in the powerful case he's making in favour of the hospice movement, indeed all colleagues, during this debate. Does he agree with me that every penny the government gives to the hospice movement takes pressure off the National Health Service? They're doing the job that otherwise the NHS would have to do. And will he join me in congratulating the St Francis Hospice in the village of Havering, Attybower in my constituency, established in 1975, many years of serving the local people in the London Borough of Havering and the surrounding area. It's a magnificent organisation. The hospice movement does a fantastic job for the people of the entire country, and really it's time for the government to do more.
Once again, can I please thank my honourable friend for his intervention, and once again I completely commend everyone in Havering, St Francis and hospice staff there for what they do. It sounds remarkable, and we've heard so many stories this evening of other hospices and palliative care providers right across the country, and the message is quite clear. We need more funding. We've got to establish better funding models for it. We can't rely so much upon charities and donations. We have to make sure also the funding is provided up front. And I just think this is such an important life and death issue. And the fact that also they take, they take pressure off the NHS in terms of what they provide. If you go to Thames Hospice, for example, you look at the facilities there, they're so modern, they're state-of-the-art. I think we could sweat the asset an awful lot more. And perhaps it might even be that underutilised capacity of hospices could in some way be hired back to the NHS for the facilities they've got. But I think we can do more to sweat the assets. Please do.
I'm very grateful to my honourable friend for giving me. I just want to put this one final point in the final backbench contribution to this debate. We've heard many people call for multi-year funding settlements. Now that's not to make life easy for the hospices, but it makes life more sensible for them to be able to plan into the future, in order for them to sign leases, buy equipment, train, recruit and retrain staff. It's there in order. The request for multi-year funding settlements is in order to allow them to put the plans in place to provide the care that they need.
Yeah. Once again, thank you to the member for Darlington, and I agree completely. Nobody can plan in a vacuum. And therefore, this is about more money, this is about earlier money, this is also about the ability to plan so that we know what the delta is. Madam Deputy Speaker, I'm going to conclude now, but thank you for the opportunity of speaking this evening. We need more money, Minister, and I know you'll give it to us.